Welcome to Laughing Jade Self-Care Inspirations. I'm Mindy Reeves, and today I'm going to talk a little bit more about your shoulder and more ways that we can help out relieving our pain, creating more range of motion. So as we discussed in the part 1 of this video, shoulder tension is created most of the time through the contraction of our front body and the overextension of our back body. And usually we feel the pain in the back body. So working on the front body seems like, why would I need to do that? But I'm telling you, go back to part 1, try it out. Loosening up these pecs is really going to jumpstart your shoulders feeling a lot better. So there's a couple other components that go in with that. The neck is directly connected to our chest and to our back. So a lot of times if you have shoulder pain, you're feeling it also in your neck, maybe even up into your jaw, sometimes down into your arm as well. So one of the first things that I would recommend that you do is just some simple neck stretches. So getting your back into nice alignment. You have your crown of your head stacked right above your shoulders. Everything's lined up down below. We can just look the head over to the left as far as you can until you meet a stopping point, or if there's any pain, you'd also want to stop there. Just going as far as you can, very comfortably, and then going back the other way. And you want to do this about, let's say, 10 times on each side, and you'll notice if you keep going up, meeting your stopping point or meeting your pain point, it's going to increase, just even with 10 rotations. So doing this nice and slow, rhythmically, and using your breath. Ideally, you might inhale as you go to the side, and exhale as you come back through center. But either way works fine. If you'd like to do it the opposite, that's cool too. Just make sure you are breathing. And then let's come back to the center, making sure those shoulders are dropped back and down. We'll let the right ear fall towards the right shoulder and just let it hang out there, rest for a second. Inhale, float it back up to the center. Exhale, let the left ear fall towards the left shoulder. Take in a couple breaths. And on an inhale, float it back up to neutral again. So let's do a couple of our awesome shoulder rolls. This is strengthening the back body, moving the shoulders back and down towards the heels. That's going to counteract that overstretching that we're doing most of the time. And it's also elongating the front body. So rolling back. Cool. So first we open up the pecs with part 1 of the video, and then we're going to move to the back of the shoulder. So we have 4 muscles that are included in our rotator cuff: supraspinatus, infraspinatus, teres, and teres minor. So that might all sound like gibberish to you. You don't have to remember those names. What you do want to figure out is you want to reach your opposite hand behind your back and find this bony spine of the scapula on top. So you'll be able to run your finger and feel this bone here. So if you can feel that spine, stick your other finger right above it, and there's the indentation. So there's a little groove here that top muscle sits in. Then come back to the spine and feel right below it. You can even hook your fingers and kind of pull a little bit. Infraspinatus right here. So it just runs along that spine. So your teres is going to be, if you reach your hand underneath your armpit, you can kind of feel this bottom corner of your scapula. So you can feel that line, and then you've got a little muscle up in there that's gonna feel kind of sore to you. So you got those important muscles with your rotator cuff, and we also have rhomboids and trapezius. These are gonna be located in this area here where you kind of, naturally think of getting massage when you're rubbing someone's shoulders. You don't really need to spend as much time there, but it does feel really good to get into some of those trigger points and let them release. So I'm going to show you with a ball how you can do this now. So you're going to grab your therapy ball. That could be a racket ball, a lacrosse ball, a tennis ball, your dog's play ball, or even one of my favorite clients has started using an orange, and it's worked really well for him. So whatever you can find, something about this size, I'm going to use Racket ball because it has a little bit more give, a little bit of a rubberized kind of surface, so it gives you more grip. And you can find these on Amazon or at Dick's Sporting Goods, any sporting goods store. So, finding an open wall, we're going to bring our back up against the wall, taking the ball and placing it right underneath that spine of the scapula that we located, so right on the underside. Placing the ball against the wall and pressing in. So we're letting our arms relax, we're rolling our shoulders back and down, and the hands can just drop. So as you start to lean your weight into the ball, you're going to start to feel some of those tension areas. It's going to feel like a little bit of a dull, aching pain. This is called a productive pain. As long as you can still breathe and relax, you're in a good place. So you can press and hold. You can start to roll the ball a little bit towards the outside of the shoulder. Continue to press in. Continue to release any tension from the shoulders and the arms. And if you want, you can kind of shift, rolling the ball along the length of that spine of the scapula. And so down below, we've got rooted feet. We've got slightly bent knees. And I'm just rolling very easily across this muscle. So for infraspinatus, the muscle that's on the top side of this spine of the scapula, we're going to get a little bit deeper squatting stance. We've got the ball right above the spine of the scapula, and we're going to do the same thing. Press and hold, or slowly rolling across that muscle to the outside of the shoulder and back towards the spine. And continuing to breathe. Wonderful. Now I'm going to bring the ball to right in the middle of the scapula. So the scapula forms a triangle shape. Kind of looks like Africa or a T-bone steak. Roll all around on that triangle, the plate. So put the ball back there and just freestyle in it. You're using your knees are bent and they are right above your ankles. We have a good stance, we're supported below. At some points that you're rolling around, you may feel you need to pick the ball up and readjust. So one cool thing I like to do, when I find a nice hot spot, again, just approaching your edge of pain, not going over your edge. Hold it there, bring the arms down, and then allow the arm to raise up and come back down. So you're moving the joint and the muscles through range of motion as you're applying pressure. This is an active release technique that's going to really allow everything to start to really relax. So you can also do rotation and doing all this very slowly. If you feel like you need to angle your body a little bit differently, you can get creative here and just find all those really deep spots that you have built up. So rolling around, and then we can bring it to trapezius and your rhomboids, pressing in there. So this is in between the spine and the scapula. So there's a little channel that's created, and we can just bend the knees, rolling the ball up. As we straighten the knees, the ball rolls down. So this one takes a little bit of practice to get really comfortable with placing the ball in the right place, to get good stance. So rolling up and down, and also you can do a little side to side. Feels really good. And this is another great place to press and hold, do some range of motion. You can, with this one, draw the arm across as well. And if you'd like to add a gentle stretch in there, locking the arm, and then a little bit of motion with the ball. So when you're finished with that, let's do and down. And we'll do some hitchhikers, pulling the elbows back, sending the thumbs backwards. Cool, so that's gonna rotate the arm bone back outwards. It's setting the arm and the shoulder back in place where they should be. So this is a simple self-care neck massage that you can do. It helps with jaw as well as shoulders and back and your neck. So you are gonna come right behind your ear. This is the start of your sternocleidomastoid muscle, your SCM. This muscle runs from here down the front of the neck to here in this little notch. So that's the one when you turn your head, you can kind of see this line, that's that muscle. So it's really easy to locate. You have that, and then you have this whole area that's right above the collarbone. So we're gonna be sweeping in this whole area. So it creates this triangle from the ear to the inside of the clavicle, outside of the clavicle, back up to the ear. So, and this is great for lymphatic drainage as well. If you have any sinus stuff going on, if you've been sick, this can really help to clear things out, draw all that stuff back to the ducts that are going to filter the toxins out of your body. So let's start up here at the ear, and you can use one or both hands. I like to use both. So I'm sweeping down this triangle like this. So the inside hand is coming towards this center notch. The outside hand is sweeping out towards the far end of the clavicle. So I'm using all the fingers here to really cover the whole area. So one thing you do want to note, this sternocleidomastoid muscle, it marks the line on the inside of here is where your jugular and your carotid artery are. So we don't want to go too deep at all on the inside of that line. Staying on the outside of it is good, and you'll be able to feel very easily as you start to get a little too close. It just feels uncomfortable. It doesn't feel good. And some light pressure there is fine, but we never want to go too deep on that. So leaning that head gently over and making these nice smooth motions, and I'm not even applying all that much pressure, just the dragging, the fascial pulling of the neck is really allowing this stuff to loosen up. And as I do it repeatedly, you can kind of feel it really let go, and you'll be able to even stretch your neck a little further. It'll be pretty amazing that you can see that happen in yourself. So doing both sides as always, and being gentle with yourself at first. You can kind of build up the pressure as you go along. So another thing here, as you're sweeping, you can allow the head to rotate a little bit. So I'm moving through that rotation as I'm applying this pressure out and down. And I find different motions help. So this one I'm dragging straight down towards the inside and looking up. So just experiment. See what works for you, see what makes your neck feel good, and that's where you want to be. So thank you so much for watching, for joining me today. Let me know if you tried it out and if it worked well for you, or even if it didn't work well for you. This is a sequence that I would recommend if you're having active pain. Doing this 1 to 3 times a day would be awesome. And for maintenance, doing it once a day is really great. You don't have to spend forever on it, even if you did it for the whole sequence only taking 2 minutes. That would really make a huge difference in your life. So thank you so much, and please comment, share, subscribe. I'd love to connect with you. Head on over to laughingjade.com and sign up for my exclusive email list so that you can receive my latest self-care ideas and more cool anatomy info.